Borderline personality disorder is a disorder defined by a long-term pattern of intense and unstable interpersonal relationships and strong emotional reactions. Those affected often engage in self-harm and other dangerous behaviors, often due to their difficulty with returning their emotional level to a healthy or normal baseline. They may also struggle with feelings of emptiness and a fear of abandonment. Common behaviors include eating in excess, unprotected sex, or reckless spending and reckless driving. Impulsive behavior may also include leaving jobs and relationships or running away. Their feelings about others often shift from admiration or love to anger or dislike after a disappointment, a threat of losing someone, or a perceived loss of esteem in the eyes of someone they value. This phenomenon is sometimes called splitting. Combined with mood disturbances and devaluation, can undermine relationships with family, friends, and co-workers. While strongly desiring intimacy, people with BPD tend toward avoidant or fearfully preoccupied attachment patterns in relationships and often view the world as dangerous and malevolent. Dependent personality disorder is characterized by a pervasive psychological dependence on other people. This disorder is a long-term condition in which people depend on others to meet their emotional and physical needs, with only a minority achieving normal levels of independence. They are over-dependent on other people when it comes to making decisions. They cannot make a decision on their own as they need constant approval from other people. They tend to be more introverted and are more sensitive to criticism and fear rejection. Schizotypal personality disorder is a disorder characterized by thought disorder, paranoia, a characteristic form of social anxiety, and unconventional beliefs. People with this disorder feel pronounced discomfort in forming and maintaining social connections with other people, primarily due to the belief that other people harbor negative thoughts and views about them. Peculiar speech mannerisms and socially unexpected modes of dress are also characteristic. Schizotypal people may react oddly in conversations, not respond or talk to themselves. They frequently interpret situations as being strange or having unusual meanings for them. Paranormal and superstitious beliefs are common. Schizotypal people usually disagree with the suggestion that their thoughts and behaviors are a disorder and seek medical attention for depression or anxiety instead. Schizotypal personality disorder occurs in approximately 3% of the general population and is more commonly diagnosed in males. Narcissistic personality disorder is a disorder characterized by a lifelong pattern of exaggerated feelings of self-importance, an excessive need for admiration, and a diminished ability to empathize with others' feelings. People with NPD struggle with intense and pervasive feelings of shame, worthlessness, and low self-compassion. Their view of themselves is extremely malleable and dependent on others' opinions of themselves. They also are hypersensitive to criticism and possess an intense need for admiration. They gain self-worth and meaning through this admiration. They generally lack self-awareness and will have a difficult time understanding their own traits and narcissistic tendencies. Narcissists can have difficulty seeing multiple perspectives on issues and black and white thinking. Despite this, people with NPD will often feel as if they are skilled at accurately assessing others' feelings. Schizoid personality disorder, characterized by a lack of interest in social relationships, a tendency toward a solitary or sheltered lifestyle, secretiveness, emotional coldness, detachment, and apathy. Affected individuals may be unable to form intimate attachments to others and simultaneously possess a rich and elaborate, but exclusively internal fantasy world. Other features include stilted speech, a lack of deriving enjoyment from most activities, feeling as though one is an observer rather than a participant in life, an inability to tolerate emotional expectations of others, a degree of asexuality, and idiosyncratic moral or political beliefs. Antisocial personality disorder, characterized by a limited capacity for empathy and a long-term pattern of disregard or violation of the rights of others. Other notable symptoms include impulsivity and reckless behavior, including substance abuse, a lack of remorse after hurting others, deceitfulness, irresponsibility, and aggressive behavior. Antisocial behaviors often have their onset before the age of 8, and in nearly 80% of ASPD cases, the subject will develop their first symptoms by age 11. It peaks in people aged 24 to 44 and often decreases in people aged 45 to 64. APD is more common in males than females. Antisocial personality disorder has been associated with higher levels of impulsivity. It is highly prevalent among prisoners. People with ASPD tend to be convicted more, spend more time in jail, and are more likely to be charged with almost any crime. Assault and other violent crimes are the most common charges. Paranoid personality disorder is a disorder characterized by paranoia and a long-standing suspiciousness and generalized mistrust of others. People with this personality disorder may be hypersensitive, easily insulted. They are eager observers, and they often think they are in danger and look for signs and threats of that danger, potentially not appreciating other interpretations or evidence. They tend to be guarded and suspicious and have quite constricted emotional lives. Their reduced capacity for meaningful emotional involvement and the general pattern of isolated withdrawal often lends a quality of schizoid isolation to their life experience. Histrionic personality disorder. People with this disorder show a pattern of excessive attention-seeking behaviors, usually beginning in early adulthood, including inappropriate seduction and an excessive desire for approval. People diagnosed with the disorder are said to be dramatic, extroverted, and flirtatious. People with HPD have a high desire for attention, make loud and inappropriate appearances, exaggerate their behaviors and emotions, and crave stimulation. They often fail to see their own personal situation realistically, instead dramatizing and exaggerating their difficulties. Research has also shown those with histrionic personality have a greater desire for social approval and reassurance and will constantly seek it out, making those with HPD more vulnerable to social media addiction. They will work hard to get others to pay attention to them, possibly as a method of testing the stability of relationships. They usually have good social skills, despite tending to use them to make themselves the center of attention. Avoidant personality disorder. They have excessive social anxiety and inhibition, fear of intimacy, despite an intense desire for it, severe feelings of inadequacy and inferiority, and an over-reliance on avoidance of feared stimuli as a maladaptive coping method. Avoidant individuals are preoccupied with their own shortcomings and form relationships with others only if they believe they will not be rejected. They often view themselves with contempt while showing a decreased ability to identify traits within themselves that are generally considered as positive within their societies. Loss and social rejection are so painful that these individuals will choose to be alone rather than risk trying to connect with others. Some with this disorder fantasize about idealized, accepting, and affectionate relationships because of their desire to belong. They often feel themselves unworthy of the relationships they desire and shame themselves from ever attempting to begin them. If they do manage to form relationships, it is also common for them to preemptively abandon them out of fear of the relationship failing.